Hi, I'm Dr. Sharon Smith. I am a board-certified obstetrician and gynecologist in private practice in the Houston, Texas area. So with the advent of COVID virus that we've been dealing with here in Houston for the past 4-6 weeks, so I'm going to go through some of the most frequently asked questions from my patients. So one of the questions I usually get asked is, do I come to all of my visits? Well, the answer to that is it depends. We do have telemedicine, so we can spread out some of your visits. We tend to spread out the visits in the office. We can do some of your visits by telemedicine. Some of them that we can do are, checking medication, checking blood pressure. If you're diabetic in pregnancy, go over your diabetic numbers and make sure you control, make sure you get everything you need. Or some patients just want to see us just for the emotional support that we can provide. Okay, another question that I get is, should I be tested? At this time, we do not recommend testing without symptoms because we just don't have the test available. Hopefully in the future, when testing is more readily available, we can all be tested and to see where we stand. We recommend testing now just based on symptoms. So if you're symptomatic, make a telemedicine visit. We'll assess your symptoms, we'll get you tested, and then we'll go from there. How likely am I to get COVID if I'm pregnant? So pregnancy itself lowers your immune system. So your susceptibility to almost any viral illness is actually pretty high. So you as a pregnant mommy, you can get COVID. Your rate of death is not any higher than the non-pregnant population. Another question I get is, do coronavirus causes birth defect? As of today, we have no evidence that coronavirus causes any birth defects. However, we do know that if a mom becomes ill with coronavirus, she's a high likelihood of preterm labor, preterm delivery, and all the sequelae of preterm delivery. Another question I get is, if I have COVID-19, can I transmit that to my baby? As of now, we have no evidence that you can transmit coronavirus from mom to baby while the baby is still in the uterus. Remember, all of this is new, so we're learning, I'm learning, and as I learn, I will, provide the information for you guys so that you can stay up to date. But there's no evidence that there's any vertical transmission from mom to baby. Another question I get, is it safe to deliver in the hospital? The answer to that is yes, 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 and yes. We are completely prepared to deal with anything that comes into labor and delivery. The American College of Obstetrics and Gynecology does not recommend a home birth. I do not recommend a home birth. Labor can go really bad, really fast. So we are prepared in the hospital, even with the pandemic, to take care of our patients. So another question I get is, can my baby get COVID through breastfeeding? The answer to that is no. So we know that antibodies are transmitted from breastfeeding from mom to baby, that's always a good thing. It protects the baby. However, there's no evidence that COVID is passed from the breast milk to mom. Now, if you're symptomatic, you may not be able to breastfeed. Then we'll just have to make a really hard and sad decision to separate mom and baby so that to protect baby and to protect mom. You may be able to pump and have someone else feed the baby, but only in that circumstance we will not recommend breastfeeding. But on a whole, the virus itself is not transmitted from breast milk. The antibodies, if you have them, will be transmitted from the breast milk to the baby. Another popular question I get is, can I get COVID from changing my baby's diaper? I have a 2-year-old who's running around. Can I get COVID if I change him? The answer to that is yes. There is evidence of fecal transmission of COVID. So the recommendation is prudent hand washing. You can change your baby's diaper. If the kid, baby is COVID positive, recommend with gloves so that to reduce your own transmission of COVID or spreading it through the home. So the next question I get is, what if I have symptoms? What do I do? What I tell my patients are, if you have symptoms, which are fever, cough, body aches, chills, is make an appointment through telemedicine. We will assess you through telemedicine, and then we'll get you tested. Remember, during that time you're being tested, waiting for results, you're going to have to self-quarantine, and if you're positive and your symptoms are minimum, you're going to be self-quarantining at home for approximately 2 weeks. So this telemedicine assessment also will be able to assess you. I'll be able to look at you and say, well, this patient doesn't look good. let me get them to the hospital, then I'll call the hospital, mobilize everyone that I need to help take care of you. Next question I get is, how do I protect myself? So basically, we follow all the guidance of our local authorities, the CDC. I also follow American College of Obstetrics and Gynecology and the World Health Organization. So the precautions are basically the same precautions for everyone else. Prudent hand washing, social distancing. Now it's recommended that we wear a mask when we are out. Wear your mask. Cover your cough, cover your sneeze. If you think you're exposed, stay at home, give us a call. We'll assess you. Stay away from people who are sick. When will this be over? The answer is, I do not know. I don't think anyone really knows. I know we are under a stay-at-home order right now. I think everyone should adhere to that, except for like essential things that you might need. We completely understand that. But in order for us to flatten the curve and, figure out what we need to do is for everyone to stay home, decrease the spread of the disease, testing, A, for the virus, and B, now testing for antibodies. And hopefully most of us will become immune soon. I know there are many studies that are developing a vaccine, but vaccine development takes a while. So we really don't know how long this is gonna be. I think it's gonna be for a while. Some of the things that we do are gonna become our new normal until we have herd immunity or most people immune to it. The whole thing is to just hang tight, follow the rules, so then we can all get through this and come out stronger on the other side.